A PNP is a pediatric nurse practitioner.
We can diagnose, treat, prescribe, just like a doctor would, but with the touch of a nurse.
Kids A to C with the PNPs. M is for mental health.
Hi everyone, welcome to Kids A to Z with the PNPs.
Where each week we take a closer look at some of the common health problems affecting our kids.
We're your hosts. I'm Dominique.
And I'm Cortney.
And what are we talking about today, Court?
Today we're going to talk about mental health, which is a big topic and something that I feel needs to be talked about a little bit more often.
Yeah, actually the American Academy of Pediatrics says 1 in 5 children has a diagnosable mental health disorder. But actually only 21% of them are receiving treatment.
Yeah, and it's unfortunate. I mean, mental illness, just like any other disease, the earlier it's identified, the better the outcome is going to be. So untreated mental health problems can lead to problems at home, at school, in all aspects of life. Mm-hmm. So according to the CDC, Centers for Disease Control, mental illnesses can be defined as like serious changes in your child's behavior. It can affect the way they typically learn, the way they behave, the way they handle their emotions, and it can cause like distress and problems dealing with life.
Common examples of mental health issues that are affecting children, there's a lot of them. These are not limited, but include depression, ADHD, conduct disorder,
anxiety, learning disabilities,
and
post-traumatic stress syndrome,
and eating disorders.
Yeah. So this is a very large and obviously important topic, and we could talk about any of these diagnoses at length. They could be their own episode. But for the purposes of this episode, we will focus on like warning signs or when you should be concerned about your child and have them evaluated. Mm-hmm. So what are some of the warning signs?
Mood changes, intense feelings of sadness, withdrawing from activities that they've previously enjoyed, trouble at school, with relationships or troubles with friends that previously weren't a problem.
Yeah. Also like intense feelings, like being excessively worrying or feeling very easily overwhelmed, or conversely like intense happiness that seems out of character for the situation.
Behavioral changes, drastic changes in behavior, the urge to want to fight more.
Or your child's expressing concern to hurt themselves or other
others.
people.
Yeah.
Also like trouble concentrating in school, trouble sitting still, not being able to focus on one task.
Unexplained weight loss, changes in eating habits, increased vomiting, uses of laxatives may indicate an eating disorder.
Or even like an intense obsession with how their body looks.
Substance abuse, the use of drugs and alcohol can also be a warning sign.
Yeah, and like if your child is hearing voices or seeing things that aren't there.
So if your child is exhibiting any of these warning signs or behaviors and you're concerned, talk to your pediatrician. Your pediatrician has a lot of different screening tools to evaluate for a lot of different disorders. Mm-hmm. And you can get, like we said, the earlier it's identified, the better outcomes will be, and they can get you into the specialist that your child might need, whether that be a counselor, a psychologist, a psychiatrist, a neurologist. Mm-hmm. Any of those can be referred, or just talking to the pediatrician.
Yeah, it's also very helpful too to like talk to your child's teachers and the people that are closest to them, friends, family members, just to see if they've noticed any changes in their behavior.
Mm-hmm. So although a difficult topic to talk about, but something we must discuss, is suicide. Mm-hmm. Suicide is actually the second leading cause of death in children ages 10 to 18. So some warning signs of suicide. If your child is talking about hurting themselves deliberately, is coming up with a plan, this is a big warning sign for suicide.
Yeah, if you've noticed internet searches for ways to for ways to kill yourself, if you notice that your child is withdrawing from things that they normally like to do. They are spending a lot of time alone. They're giving away their possessions. The list goes on and on for warning signs for suicide. But I think it's important for parents to keep a pulse on what their kids are going through. Talk to your kids.
Keep an open line of communication.
Yeah, that's number one thing at home. So if you're concerned that your child may be suicidal, they should be evaluated immediately. But there is a helpful suicide hotline. It's 1-800-273-TALK. There is somebody there 24 hours a day that is there to offer you helpful advice.
It's free, it's anonymous, and anyone can call.
Yeah, it can be if you are personally suicidal, if you're concerned that your child is suicidal. It's for healthcare providers, parents, or people who are struggling. So when do we need to seek medical attention for our children? Immediately or sooner rather than later?
If you are concerned that your child is at risk for hurting themselves or anyone else, call 911 or come to the emergency department. If your child has an acute change in mental status, they're found unresponsive, or you're concerned that there might be an accidental or intentional overdose, call 911 or immediately come to the emergency department.
Yeah, or if they've had an actual suicide attempt, if you've noticed that they've cut their wrist, they tried to hang themselves. Again, these are difficult things to talk about, but they need to be talked about. So if they've had an actual suicide attempt, they need to be seen and evaluated immediately.
So what can we do for treatment for mental health?
Yeah, so treatment is obviously largely based on what the diagnosis is, but for a lot of mental illnesses, psychotherapy or like talk therapy with a psychologist or a counselor or social worker can be very beneficial. Basically in these sessions, your child gets to know the clinician, they talk about their feelings, they talk about
coping mechanisms
and how they can recover from this. Also, there's lots of medications, depending on the diagnosis. Once again, a lot of times medication and psychotherapy or talk therapy are used together.
Yeah, I think that's important to know, not just using one or the other, depending on the illness. It's found to be more productive to use them both together, medicine and the psychotherapy.
Yeah. So what can parents do to help their children?
One of the most basic things is just a positive reinforcement, praising your child's abilities, and also keeping open lines of communication. Talk to your child.
Yeah, I like in my practice too, and as a mom, I like to use open-ended questions. Like it gets kids talking. If you ask them yes or no questions like, did you have a good day at school today? They're going to say yeah. But if you say, tell me about your day. Tell me about your day today. It's a good way to keep communication. You can learn a lot about what's going on in your kids' lives.
Consider family counseling or support groups.
And making sure you talk to your child's teachers. They may have some insight that you don't. They're with your child for a large portion of the day. If there is concern for a learning disability, they can work with you to form like an academic plan, or I think they call it an IEP, an individualized education plan, to help your child succeed.
And again, the most helpful tool is identifying these and getting treatment sooner rather than later. So don't be afraid to ask questions. Don't be afraid to talk to the pediatrician. And don't be afraid to talk to your child.
Right, and mental illness is nothing to be ashamed about. I love that there's like this push lately to remove the stigma. Let's talk about it, because I think if you take the shame out of it, people will be more open to talking about it. And it's a topic that affects like a fifth of our kids, and it's probably actually underreported, truthfully. So talk about it. Talk to your kids. Talk to each other, and get them the help that they need.
I think that wraps everything up for mental health, and obviously a huge topic, but if you guys have any questions, comments, leave us a comment below. You can always email us at kidsa2z@dmc.org.
Yeah, and next week, what are we talking about?
Next week is the letter N, and we are going to be talking about nose troubles.
So runny noses, all the winter fun stuff.
Yep.
So we'll see you next week.
Thanks for watching.